Welcome to Lung Point of Care Ultrasound Module 2, Exam Settings and Transducers. Module 2 objectives include understanding depth and gain, and recognizing the principal settings, modes, and transducers used in a lung point of care ultrasound exam. When performing a lung POCUS exam, it's essential that high-quality images are captured. Missed or inaccurate diagnoses may occur with suboptimal imaging. Selecting the most appropriate POCUS setting for a given exam helps reduce poor image quality and diagnostic errors. Two of the most common ultrasound settings that need adjustment are depth and gain. Depth refers to the distance the target tissue is from the transducer's position. On most POCUS machines, depth can be adjusted either by using the up or down depth buttons or swiping up and down on a touchscreen, or by applying and releasing pressure on the body's surface with a transducer. Increasing depth brings the target tissue closer to the transducer, while decreasing depth moves the target tissue further away. If the imaging depth is too shallow, the target tissue may present in the peripheral field or be absent altogether, which will produce a poor quality image or an inaccurate image, causing an inaccurate diagnosis. If the imaging depth is too deep, the target tissue will appear in the near field and have poor resolution, which may also lead to an inaccurate diagnosis. Ideally, the target tissue should be positioned in the center of the POCUS screen. And if you look over here on my photos that I've got, on the right side, you can see that the imaging depth is too deep. The pleural line is usually what we aim for as our target when we're assessing the lungs. And as you can see, it's raised up a little higher than what it should be, and all the tissue above is compressed and resolution is kind of poor. On the far left side, the imaging depth is too shallow, and you're missing the pleural line altogether, and you can't see what pathology may be going on below. But in the center here, you can see that the pleural line is centered. You've got fairly good resolution on intercostal muscles in the chest wall, and you can see some tissue below the pleural line. I would say, if anything, on this one, the gain may need to be increased just a little bit, but the depth is good. The further sound waves travel from the transducer, the weaker they and their returning echoes become. In POCUS, gain refers to how strong or weak those returning echoes are. Increasing the gain amplifies the echoes and results in brighter images. Decreasing the gain weakens the echoes and results in darker images. Too little gain is called undergained, and too much, overgained. Many POCUS machines have an auto-gain function that automatically adjusts gain for you with changes in depth. However, some machines will require you to adjust the gain manually using buttons, or if you're using a touchscreen, it's often a swipe to the left or right. Over here, I've got 3 samples of gains. I've got an undergained and an overgained, and in the middle, a normal gain, as you can see, gives the most clear and detailed picture. Many POCUS machines come with preset exam settings designed to help the provider obtain the best view of specific tissues and structures. When performing a lung POCUS exam, the lung preset is usually recommended for the anterior aspects of the chest wall. However, many experts recommend using the abdominal preset for the lateral and posterior chest wall because it gives a better picture in those dependent regions. Mode is another setting to consider when performing a POCUS exam. There are several types of modes to choose from, and each one allows for the evaluation of the different characteristics of a specific target tissue. B mode, seen in the top left picture there, also called brightness mode or two-dimensional mode, is used for the majority of diagnostic exams and is the principal mode for lung ultrasonography. B mode gets its name from the echogenicity or brightness of the structures and tissues observed while performing a POCUS exam. M mode bottom left, or motion mode, is an older imaging mode that evaluates the movement of structures along a single scan line over time. M mode is frequently used to assess the cardiac chambers, cardiac valves, inferior vena cava, and the lung-pleura interface for lung sliding and pneumothorax. When using M mode to evaluate the lung-pleura interface in healthy lungs, the normal rhythmic movement of the visceral pleura creates what is called the seashore sign, and I can point that out to you as we go through this here. So, the intercostal walls resemble an ocean, this point to this point. This is the intercostal walls. The pleura looks like breaking waves on the beach, and this is the pleura line right in here. And the moving lung parenchyma produces a blurry, grainy, sandy beach appearance, which from this point to here is actually lung tissue. And so it looks like what they call the seashore sign. It looks like a seashore. Another mode used with ultrasonography is Doppler mode, or color flow, and spectra mode. These are used to measure blood flow direction and velocity. We don't use it very often, if at all, in lung POCUS though. Though not necessarily a setting, resolution is an important concept that should be considered when attempting to acquire a diagnostic quality image with POCUS. In ultrasound, resolution is divided into axial, lateral, elevational, and temporal categories. Axial resolution refers to how clear or distinct tissues are that lay on the same trajectory as the ultrasound beam. Sound wave frequencies, how many sound wave cycles per second, determine axial resolution, with higher frequencies having higher resolutions. Lateral resolution is the clarity of tissue and structures that are perpendicular to the ultrasound beam, and this is lateral resolution, going off to the sides. The best lateral resolution is at the narrowest section of the ultrasound beam called the focal zone, right there. Elevational resolution is the clarity of targets within the height of the ultrasound beam. Generally, objects at center height have the best elevational resolution, and that's why when we want to look at the pleural line, we like to have it, or actually any target tissue, like to have it at the center of the screen. Temporal resolution is the clarity of moving tissues. So if you're looking at the pleural line for lung sliding, then temporal resolution would be how clear the lung sliding is. The transducer, also called the probe or knob, is that handheld component of the POCUS machine that emits ultrasonic waves and captures the returning echoes. There are numerous types of transducers which differ from each other by size, crystal arrangement, footprint, and frequencies emitted. Transducers with higher frequencies produce higher resolution images, but they are unable to penetrate the body as deeply as those with lower frequencies. Higher frequencies are often used to visualize superficial structures like the vasculature, soft tissue, and joints. Transducers with lower frequencies produce lower resolution images, but they penetrate the body deeper than higher frequency transducers do. Lower frequencies are used for imaging the deeper structures of the thorax, abdomen, and pelvis. The four most common types of transducers used in POCUS include linear, curvilinear, intracavity, and phased array. Each of the four are listed over here, along with the frequency ranges, penetration depth, and general uses. Feel free to pause the slideshow and look over each one. But the big takeaway is that the primary transducer used for lung POCUS is the phase array. Occasionally a curvilinear is used, but again, the primary for lung POCUS is phase array. And that's important. You may see that again. A feature shared by all transducers is the orientation marker. The probe's orientation marker, also called the notch or index marker, corresponds to the monitor's orientation marker, which is usually a little colored square or circle on the screen. The purpose of the orientation marker is to help the provider remain spatially in tune with the location of the patient, transducer, and the image on the monitor. So, Module 2 summary. Depth refers to the distance of the target tissue from the transducer's position. Depth is adjusted by using either the up and down depth buttons or by applying or releasing pressure on the body surface with the transducer. Gain refers to how strong or weak the returning echoes are that are captured by the transducer. Increasing gain amplifies the echoes, resulting in brighter images, while decreasing gain weakens the echoes, resulting in darker images. B mode is the principal mode used in lung ultrasonography, and phased array transducers is the primary probe used in lung POCUS. And here's my Module 2 reference. Thank you for taking your time and working through this module. Please continue on to the post-test and then on to the last 2 modules. And we would like to see you at the Interactive Skills Workshop. It'll be held at Southern Adventist University, and we'll have an emergency room physician that's been trained in POCUS to walk you through a lung assessment. In order to sign up, just go to the website's menu bar, click on the ISW scheduling, and sign up for a time. All right, thank you.